Lisa Meadows, the Clinical Compliance Educator with ACHC, and today we're going to talk about preparing for your Hospice Initial Medicare Certification Survey. Once you obtain your license, the next thing you need to do is to develop your caseload for your patients for your hospice program. It is a requirement that you have served 5 patients with at least 3 active at the time of survey, and that is a CMS requirement. The next thing you need to do is to have the appropriate staff. You need to be able to provide all core services through hospice employees. So your core services are your nursing services, your social work services, your counseling, which includes your spiritual care, your bereavement, and your dietary, and then physician services. Now, physician services can be under contract. They're the one core service that you can provide under contract, and you don't have to provide that service as an employee. You need to have your medical director as well as your alternate medical director as well. The next thing you need to be able to do or to verify is that you can provide all 4 levels of care. Now, hospice care is the care that you're going to provide in the home, but you also need to be able to provide your short-term general inpatient care for pain and symptom management and your respite care. That can be done through contract or if you have your own inpatient facility. You also need to be able to provide continuous care. You also need to be able to show that you can provide non-core services. Now, non-core services means that these services can be provided by employees or under contract. It doesn't mean that you have the option of not providing these services. So your non-core services are your therapy, physical therapy, occupational therapy, and speech therapy. So you must be able to show that you can provide all 3 different types of therapy. You also need to be able to have hospice aides available to your patients, as well as having a volunteer program. Those are your non-core services. So you need to be able to provide your core services, non-core services, in all 4 levels of care. And then you also need to be able to provide the other services needed by hospice patients, such as DME and your pharmacy or your drugs and biologicals. These are the things that a hospice surveyor is going to need to be able to validate in order to even advance to the next part of your Medicare survey, which is doing your home visits, looking at your medical records and your personnel records. So make sure, in summation, that you have your 5 patients served with 3 active. You can provide all core services through hospice employees, non-core services either under contract or by hospice employees. You have your DME and your pharmacy, and make sure you have that medical director and your alternate medical director as well. For more information, ACHC will be hosting some hospice workshops in California, so you can go to our website at accreditationuniversity.com for details.